Hey everybody, welcome to your counter pressure tutorial. We're going to go over lateral pushing first. And as we're going over lateral pushing, there are different hand positions, which you can see we're going to find the middle position, which is where we find the top of the hips and the actual where the femur bone connects into the hips. We're going right in the middle. So you can find this, I feel like, the most easily in side lying. So if you're wanting to practice, I would suggest side lying first. So we are finding that middle hand placement where you're squeezing straight down towards the floor or towards the top of that other hip. This can be really helpful for active labor and kind of those mid dilation segments from like, generally we don't need this, so roughly around 4 or 5 centimeters all the way up closer towards when we're closer to 8 or towards transition. So this is the middle hand placement. This is showing you top of the pelvis placement. This, as you can see, we're going towards the hands at the very top of the pelvis. You can see how that really rocks the pelvis this way and opens up the bottom. Here we are in sitting and we are closer to the top of the pelvis because that's what we can reach, but we are really squeezing in towards our hands, and that can help open mid pelvis as well. Here's another view, and you actually watch me turn my hands inwards to get a little bit more force and to get a little bit more booty meat, which once again will help with mid pelvis kind of needs. And as we are in hands and knees, this is a top of the pelvis grip, and that's going to help open up those pubic bones, the sit bones at the bottom, so that we are helping get that baby out faster as we're making the exit bigger for baby. Here is a middle hand hold where you can really, once again, we're helping kind of mid labor with that one. And in standing, this is once again a kind of top of the pelvis. We're going to help open up the bottom. So now we're going to go over kind of sacral pushing. Sacral pushing is the kind of whole point of this is to assist once again with kind of mid-level pelvic space when our hands are on the middle of the pelvis. It also can also just help decrease some of the stress on the uterosacral ligament, which can really help with pain during contractions. If our hands are near the top of the pelvis, this is going to be really helpful for flaring that tailbone and opening up bottom of the pelvis, which once again can help baby exit faster. So as we are looking at all of these things, we'll kind of go over them, and they're in all kinds of different positions. Sitting position's easy as you are pushing through the heel of your hand, trying to push towards the front of her zipper or the front of her pelvis, the front of that chair. This is a top of the sacrum push. So as you can see right here, my hand is actually a little bit higher than where it was right here. So we're a little bit lower in there, and that is the middle kind of sacrum push to help with earlier labor. So like talking about anywhere between 5 to 8 centimeters dilated. And as we kind of come along in here, you can see that we actually start getting closer towards the top of the pelvis, which should be right about here, or where her pain line would normally sit. And that helps to flare that tailbone up now, as you can see, kind of through this area to help baby exit. Here is mid push in standing. So this can be helpful if they need a lot of pressure because you can put all of your body weight straight down. The force through my hands is coming kind of straight down and as a little bit of an angle towards her toes if you're trying to get the right push. Just ask her. She'll be more than happy to be like, nope, that's not it. And then you can always readjust a little bit lower, a little bit higher. You can change where you are sitting or leaning to get the best push for her. As we are going through this, you can also once again do these pushes on hands and knees. This is a mid-sacral push, and we are getting this push through this angle here, once again kind of through her, the front of her panty line or the front where her button is for her jeans or her shorts or her pants or whatever helps you kind of visualize your direction. Next, we're going to go over counter pressure with a partner. So for you, Dad, your hands are going to be mirroring whatever your partner, we would assume that this would be your doula, is doing, and it's going to be on the side of the pelvis or near the top of the hips, but still on the side. So this is really more for lateral pushing. And generally speaking, we get into partner pushing when we are getting closer to transition or we're needing a lot more pain management assistance. So that can be really, really helpful. And it takes a lot of pressure off of you, and you don't have to do quite so much work if we have somebody that we are pushing with. Just make sure that you have an even push, and you can ask mom, hey, does this feel even? Or is it who's pushing harder? And we can try to either increase our pressure or decrease our pressure so that way we are matching as much as possible. Okie dokie. So as we are going into our next video, you can see that we are finding the right position here. So we're kind of coming into the middle of pelvis because this would be the top of the pelvis, and we're getting in more towards middle of pelvis and really squeezing our hands in towards each other using the palm of your hands. We can do this in all kinds of different positions as long as, once again, we're trying as hard as we can to match resistance for each other. And you can see that we are getting a nice push through there. This is if we're pushing it closer to the top of the pelvis, and that's going to help open up the bottom of the pelvis. So now we're going to go over counter pressure for kind of transition and pushing, which is a little bit different than the other ones. So for you, Dad, this is going to be hands are either on the side of the pelvis or on top of the pelvis, also known as a sacral push. The where your hands are positioned are going to be much more based off of what mom has been really doing well in. So if she started out loving lateral pushing and then we moved to sacral pushing, you're going to try sacral pushing again. So, or on top of the pelvis pushing. If she's like, nope, that is not it, quickly switch and try a lateral push. It's always just kind of based off what mom is doing the best with at that point in time. So if you were rocking one and then all of a sudden she's like, nope, nope, I hate it, try the other one. Another important thing to mention is that mama's positioning does matter for transition or pushing. If you are laying on your side, we want their knees as close together as we can and getting their feet apart with a pillow or a peanut ball. If you're in hands and knees, we just want mama to get her knees as close in together as we can and feet as wide apart as we can. So that way we are helping with some just gentle positioning. So you can see here that I've got her knee really far down and her feet far apart, and I'm coming and I'm finding the top of the pelvis, and we're pushing here to get this sit bones as far apart as we can. Sorry, you know that sidebar is in the way. If you are in pushing, this can really be helpful for any point in time. She's positioned in a pushing position, but this position for you can be done at any point in time in labor. We just particularly filmed this for pushing, especially if you get fatigued. You can actually put both hands on the side of their hips and block the close side of your hips and pull in towards yourself if you're starting to notice a little bit of fatigue. This can, once again, be really helpful for pushing, especially if we get those knees really close in and feet wide apart, which, once again, I'm sorry that the slide bar is in the way. And so that's a good way to do this. Once again, it's just another video of us doing that pull so you get a good idea of how to do it. Here's a lateral push at the top of the hips in that position, and we're really opening up the bottom of the pelvis. This is your sacral push. Once again, remember that we are really going for top of the pelvis, kind of where her painting line would normally sit, and we are pushing straight down to try to get that tailbone to hinge upward and outwards. Which you can do in multiple positions for you as well. This is easier for me because in that position, I can ultimately get a lot more pressure if I'm standing. If she needs more assistance for pain or pressure, she's really loving it. So those are your different types of counter pressure options. If you need help or you have other questions, please let us know. Thanks so much.